ticks have dirty mouths. I like to think of them that way.
So let's talk about the child that I don't have.
Okay,
because
great.
I don't even know how to start the conversations. So is there such thing called vertical transmission mother to child?
It hurts me to think that while I was so happy to be pregnant, like giving them all the love I could, I also gave them all Lyme. When the zombie apocalypse hits, you'll be all tuned up.
Once the person is treated, they cannot go back to the same environment.
What is it? Insanity is doing the same thing over and over and expecting a different outcome, right?
Yeah.
So what we're trying to tackle in longevity medicine is to undo all the stuff we did to mess ourselves up our entire lives.
Besides that, what do you suggest to families not to do to their kids, like food-wise? I'm Dr. Esra Çavuşoğlu, and I've been living a sober life for the past 19 years. My battle with addiction drove me to seek new methods, devices, and supplements to improve my physical and mental performance, enhance my quality of life, and ultimately live healthier for longer. From my experiences in addiction recovery, biohacking, and longevity to the latest global developments, from groundbreaking entrepreneurs to expert academics, the conversations I've had over the years are now featured weekly on Soberhead Podcast. Welcome to Soberhead Podcast. Today's episode dives into one of the most misunderstood and underdiagnosed drivers of chronic illnesses, Lyme disease, especially in children. My guest is Dr. Cynthia Keller, a pediatrician and a functional medicine physician who spent years working with families navigating chronic Lyme, Neuro-Lyme, autism, ADHD, gut dysfunction, and complex immune conditions. We explore how Lyme disease can quietly shape the brain, behavior, and immune system, and why early intervention matters more than most parents realize. We also reframe ADHD not as a deficit, but as potential superpower when properly supported. Finally, we unpack how COVID-19 changed the way we understand chronic disease, pediatric immunity, and long-term resilience. If you're a parent, clinician, or someone trying to connect the dots between infection, inflammation, and child development, this episode may change how you see pediatric health forever. This episode of Soberhead Podcast is brought to you with the support of Gedik Foundation for Education. For over 30 years, Gedik Foundation has been providing opportunities for youngsters, children, and women to realize their dreams through scholarships, projects, and social work. And we're proud to be on this journey together. Investing in education is investment in the future. Subscribe and support us in our quest to bring you the most current scientific data and continue your access to the world-renowned experts in their fields as guests on Soberhead, with Turkish translation and completely free of charge. Comment on the episodes, like and share. Kadın bedeni yıllarca erkek verileriyle anlatıldı. Beslenme de öyle, fitness de öyle, beyin sağlığı da. İşte Longevilab Women's Summit tam olarak bu yüzden var.
Esra Çavuşoğlu'nun ev sahipliğinde dünyanın önde gelen uzmanları kadın biyolojisini merkeze alan son bilimsel gelişmeleri İstanbul'a getiriyor.
Bu bir konferans değil, artık netlik isteyen kadınlar için yaratılmış güvenli bir alan.
11 Nisan 2026, The Grand Tarabi Otel'de gerçekleşecek Türkiye'nin ilk ve tek kadın longevity zirvesi için avantajlı biletler ön satışta.
Bedenimde olanları bilmek ve buna uygun yaşamak istiyorum diyorsan, Longevilab Women's Summit'te bize katıl. Dr. Cynthia Keller, welcome to Soberhead Podcast, my friend. I'm so excited.
Thanks, Ezra. I'm really excited to be here.
Cynthia, you're a pediatrician. Also, you are I don't want to say functional medicine doctor because you said that you're in one of the very first genre of functional medicine, integrative medicine. You're an integrative medicine doctor. You also are in the team of Dr. Goodenow, so you do a lot of work around probably neurodegenerative diseases, I would assume. Welcome. We're going to touch base on a few different things today. And one thing, it's about Lyme disease and also the Babesia, I guess, the double strength infection in a way I learned. It was difficult to understand. And the other part of the podcast is going to be about children. At that point, you need to guide the lead because, because I don't have children, probably I would ask some dumb questions. So I need your guidance. But let's start with the Lyme disease. The reason is I know that you had at some point a Lyme disease and you're in remission, but depending on your environment, some symptoms are coming back and it's a constant mindfulness in a way to how to live, correct?
Yes.
And therefore, I'm sure you're also treating people for that.
Yes. So I actually got Lyme. I got bit by a tick when I was 10 or 11, and I remember the tick bite. And then, but we didn't really know very much about it then. I was in California. And so we certainly weren't talking about it in California, right? Somewhere like the East Coast where they're thinking about it. If someone gets bit by a tick, they give antibiotics acutely. And then it doesn't usually go chronic. So it went indolent. And then I started getting really sick in my teen years. And I was actually diagnosed with chronic Lyme in California in 85 or 86, which is kind of unheard of. And then I got better, and then I kind of forgot about it. And then I learned more about it, maybe starting. And when I say learned more about it, I had to figure out how to treat it actually first in some of my patients. And I still wasn't like thinking about it with me. And then I think it was maybe during residency, I have 3 kids. One I had before medical school, one I had in my 4th year of medical school, and one I had in my 3rd year of residency. I mean, that's probably too much. So that would be an example of the environment being too bad. I got run down. I sort of think of someone with Lyme as it's in them. And then as long as they're like this, they're okay. But if they get kind of knocked by something, then it rears its head. And
shall we then start like explaining people, because I had a few people reached out to me that they would like to know about Lyme disease, how to be treated, why it comes back, the symptoms, and also the Babesia. So let's explain first to our audience, what is Lyme disease? What is it getting transferred from?
I would say classically it's transferred from a deer tick. And I think there are different strains that we find both in Europe and here, actually. So there's like one that's a European strain and one that's a US strain. And in short, when we talk about Lyme, most people in my field sort of mean Lyme and associated diseases, but it kind of depends on who you're talking to. So if it's someone who doesn't really know, they might just think it's Borrelia, which is the spirochete, which actually lives in 3 forms. So it can be active as a spirochete. It can be something called the L form. And then it can also be dormant in a cyst. And it's tricky, right? So sometimes it's in tissue, sometimes it's out of tissue. And so when you're bit by a tick, if you are treated acutely, then oftentimes that's it. So, if you're given doxycycline for 3 weeks at the tick bite, it's usually fine. But when we talk about chronic Lyme, what we mean is that it isn't treated and it gets into your tissue. And then once it's there, it does 2 things, right? One is it causes its own problem. And then the other thing is our immune system can't find it all the time. So it does the best it can. And there's sort of like a big immune response. So the immune system is overactivated. The body is smart. It'll always do what makes the most sense. So in this case, it's chronic inflammation because it can't find it. So it lives in your joints or whatever. So ticks have dirty mouths. I like to think of them that way. So if I find Lyme in someone, I just assume that they have Lyme and ehrlichiosis and anaplasma and Babesia and Bartonella. But of those, the 3 Bs would be the biggest. And so what can happen if someone has Lyme, and normally, let's say their symptoms are fatigue, joint pain, and brain fog. And let's say one of the times they get tipped. So by that, I mean life, you're not winning the sort of ability to cope physically and whatever stressors. So once you tip, then it tends to come out.
And it can be like anything, like, stressors. You were talking about your school journey, therefore it's stress. It can be toxic elements in the house, probably.
Yep, like mold. And it can be infection like, let's say, COVID. And, we can circle back around to sort of my theory on what people are seeing now. But so it can be anything. I mean, I even think like the stress of getting married, finishing a thesis and winning the lotto could probably do it. It's stress of any kind is hard on the body. I think it's about learning how to keep yourself as in alignment as possible, which is why with my patients, when I've had to treat them over these years, and a lot of them were kids, right? So they're missing school. These kids are out of school for years. You know, they've seen 17 doctors, and I clean them up, but it takes a while. Now they're out of remission or into remission. And I say, like, I'm so sorry, right, that you've had to go through this, because it sometimes feels unfair to them. But I would always say that when the zombie apocalypse hits, you'll be all tuned up, right? And the zombie apocalypse did hit, and we could talk about that later. But to finish the thing about the dirty ticks mouths. So I would say that once someone has the diagnosis of Lyme, and by that I mean chronic Lyme, when I say Lyme from here on out, that's what I'll mean. Yeah. That if, let's say, they were like this, and when they tipped this time, they went crazy. Like, I've seen people become homicidal suddenly, or suicidal suddenly, or they're just kind of crazy, and the balls of their feet hurt for me in the morning. So those are sort of my classic Bartonella signs. So if they tip and that's what they are looking like, I will probably track my treatments that time to get them back into remission, more focused on Bartonella. Then Babesia is the one where they have sort of cyclic fevers, and they're super sick. That's kind of like a malarial illness where the pathogen gets into the red blood cells and starts lysing them. So you don't get blood flow to tissues, you're anemic, a whole bunch of things happen. So if that person tipped and suddenly they can't get out of bed every 2 weeks because they have a fever for a week, I would push my treatment towards Babesia.
So basically, when you said dirty mouth tick is more like carrying another infection with it and bring it to you, is that's my understanding.
That's right. So sort of all those I just said, we sort of think of as Lyme associated. And so for most of us in the field, if we have documentation, you have one, we can either then continue to test every time you tip to see who you have, or at least what I do, I don't do tests if it won't change my management. And so I usually don't test. I treat on symptoms at that point, trying to decide who's the worst.
Is there an ongoing, I want to say treatment, but not like with like a pharmaceutical medicine, but is it like keeping your immune system high? So basically it acts like an autoimmune disorder, sounds to me.
That's right. And an infectious disorder. So it's both, right? Because you're not fighting the infection. So it actually gets into your brain and stuff.
How?
But you, well, because it goes there. It goes into your joints. It lives in your connective tissue. And you can use those tricks actually to bring it back out. But Neuro-Lyme absolutely will show up as psychiatric disorders. Like, I mean, there's like a lot of people who that is actually the issue. Like I said, those homicidal patients, actually it's just one that went homicidal. He would call me from inside a room because he wanted to kill his mom, but he knew he didn't really want to. Anyway, so it gets into the brain, absolutely.
And it stays with you forever. If you get into a chronic Lyme, then it's with you forever. And you have to pay attention to it. That's what probably you were going to say, how to take care of themselves.
Yes. And so first of all, yes, it's with you forever. I like to say, like, I'm okay with Lyme being here, but I'd like it to sit down and shut up. You know, I want to be in charge. And that is true as long as I don't tip or someone doesn't tip. And I think you can think of it like a bucket, right? And this is true for a lot of things in, autoimmune or inflammatory issues, is that, you can take sort of so much. And then once you hit a tipping spot, the bucket overflows. And then all the things you do to strengthen yourself are like holes in the bucket to help keep it draining. And that's different for different people. For some people, genetically, mold is devastating, right? Like maybe a fourth to a third of the population, genetic wise, even when you remove them from mold, they still have a big issue. So for a lot of people that would do that. Maybe you have celiac and you're eating gluten, or maybe you're sensitive to gluten, or maybe you're not sleeping, or just whatever it is. So for each person, that's why it's about teasing things apart for me. So, I look at the patient, I think, what's the most likely story? I try one thing, and then the patient tells me, like, oh yeah, that helped, or oh no, that made it worse. And then we're like, aha, and then we pull another string. If that one worked a little bit, we go further down that path. And I mean, that's partly why these are so hard to treat, right? Is that
it's
I mean,
almost like an interesting, it's hard to treat, apparently. I can see that. I did a podcast with Neisha Winters, and we spoke about cancer as a metabolic problem. And how she was explaining is that once the person is treated, they cannot go back to the same environment because there's something in that environment causing cancer to them. So they have to have a air cleaned house and, non-pesticides food and stress-free blood. It seems like very parallel. And if one of these multiple elements gets strongly disturbed, then something starts flaring up inside.
That's exactly right. And I would say that's sort of exactly the same, right? What is it? Insanity is doing the same thing over and over and expecting a different outcome, right?
Yeah.
So that's beautifully said. If you go back to the environment that created cancer or that tipped you, yeah.
How about this vertical transmission, mother to child?
Yeah.
The reason, because, I'm going to talk about some celebrities now. When I was living in the United States and, I had a partner who was watching Beverly Hills, Wife of Beverly Hills or something like, I forgot the full name now. And there was this model over there from Netherlands or something. And she had Lyme disease and she would get really, really sick time to time. These days, we see her kids on Instagram in the hospital and so on. So all three of her kids, I guess, or two of her three kids has Lyme disease. So is there such thing called vertical transmission mother to child?
I mean, 100% we know that. So, I love being pregnant. There's maybe nothing that makes me happier. I'm kid obsessed, right? And it hurts me to think that while I was so happy to be pregnant, giving them all the love I could, I also gave them all Lyme.
Do they have Lyme?
Yeah, they do. Yeah. I would say that if someone's kids are in and out of the hospital, someone is not treating Lyme well. Once you know that, then you should watch for early tipping and get them right back up. Anyway, I just sort of put that out there. Maybe they need a better Lyme doc. Depending on how active it is in the mother at the time, she's more likely to send it through during pregnancy. If she was tipped, remember I said that in my third child, I was in my third year of residency, so not sleeping and pregnant. And he definitely got hit the worst because it was clearly active in me. I would say that's true for, tons of people. And there are things you can do, though, if I were going to get pregnant again, which I'm not, I'm in my 50s. Yeah, I'm a grandma and I'm really happy twice over. So I'm happy to do that and raise everyone else's babies here at the office, right? So we can give them antibiotics during pregnancy that are safe. And, it's always about weighing the pros and cons, right? So you don't normally want to give anything in pregnancy, but you really don't want a kid who's set up for Lyme. And so if you have a Lyme literate doc, someone who's good at doing that, they can make sure that a pregnant woman is doing the best we can not to send it. And I just feel like I need to say too, Neuro-Lyme in an infant can show up as behavior issues or chronic rage, or even I would say probably autism. Not, autism isn't one thing. So I don't want people to think that all autism is that, but I have seen that happen. In fact, I just recently had a patient who's has been neuro-irritable since she was born. And I would look at her and I'd think where is the problem? And I worked her up. I sent her to every specialist because I wanted to we got to fix this. And just recently, mom presented with babesia. And then I went, bam, actually it was my nurse who said, do you think we should test the kid? We tested her. She's positive for babesia. So oh my gosh, because she can't be out of the house because she hurts people. And so she's 7 or 8 now. So suddenly I have a treatment option. She's been on all kinds of psych meds for most of her life and without huge success.
Let's come to that now because, since you jumped into it, children category, which, we shared kind of, I think, good information about the tick. And it seems like, you kind of try to stay healthy. I think it's the only way to live with it. Otherwise, it's going to take over your life and your health. I mean, period. And one thing I'm going to ask about the newborn, then let's jump to the children part of our discussion. So if you know that you have a Lyme and then you're going to pass that to the kid, is there a way to intervene at the birth or like at the very beginning of their life to get rid of that? Or since because, you know, it's a part of a mother coming out, it's just in them and they're going to be living with it?
Yes. So I would say, like anyone with Lyme, we don't treat people, treatment is aggressive often and really time consuming. So I don't treat a problem that doesn't exist, knowing I'm not going to eradicate it from a human, right? Once if you were bit by a tick acutely, you can, I think. But, if it's just in them, sometimes we will treat at birth, like that kid that was so irritable. I definitely would have treated that, like would have changed the trajectory of the child's life. But the mom was normal and didn't have any symptoms of tick-borne illness until COVID.
How do you treat the neuroinflammation in that? The neurotic or Neuro-Lyme?
Right. I mean, you're more aggressive. You have to use herbs or antibiotics that get into the brain. So when it's neuro, we're much more aggressive. And I would say everyone has their bag of tricks. There isn't like one protocol, but like a lot of people end up with ports actually because we're having to give IV antibiotics. And antibiotics or anything, it's about weighing the pros and cons, right?
Sure.
So
since you're an expert in gut health, I'm sure that
yes.
you think of that, and if you
Absolutely.
have no other option. So
right.
Let's come to this fun part that let's talk about the child that I don't have.
Okay,
because
great.
I don't even know how to start the conversations, but I was fascinated by how your clinic is filled with, I didn't actually know that a pediatrician would kind of see everything and these kids wouldn't go nowhere. And now I'm kind of thinking, not in my time, but my brother is 10 years younger than me, and there's this very incredibly well-rounded pediatrician, and he would be able to diagnose anything and everything in a kid just with one look. And it's just one behavior or one calmness or one hyperactivity or something or any type of an illness, not like just neurodivergence. He would understand. So then when I talked with you, you told me that you have a clinic that is actually the only one in your area. So all the kids are coming to you where you live, correct? And you're seeing from ADD to autism to anything, I guess.
Right. So I would say that I'm not the only pediatrician, right? Like I'm the weird pediatrician, and we have like a 200 family wait list, so I can't see all the babies, right? But the babies that I do have, I think what's different about us is how we're set up. So we're multidisciplinary. I have 5 naturopaths. I have a massage therapist, an acupuncturist, a classical homeopath, an Ayurvedic medicine doc. And as a clinic, we take care of the families. And so I started as a pediatrician, but then I fell in love with the moms and dads, right? Like I've raised families with them. We're very intimately connected. And so the way I went on to get more board certification was because people I loved became middle-aged and started to need bioidentical hormones. And this is in the early 2000s when no one was doing that. So I had to figure it out. So we ended up we take care of the whole family. If I can't take care of a kid if the parents are not well. And so if someone joins, they join as a family, and then I don't see the adults, but I oversee the care. So there's that, I would say. And it's not like I'm a specialist in Lyme or I'm a specialist in autism or I'm specialist in ADD. I treat a child and now I'm in love with that child. And no matter what that child does, I'm going to solve it. So, one kid has something, I figure it out. That's in my bag of tricks. For the next kid who looks that way, if that doesn't work, I'll get new tricks. So it doesn't matter what they have. And, I've been in practice 25 years and I'm now raising babies of babies.
You're right.
So which is amazing.
You're
it's
right.
amazing.
I know that you're very experienced on gut health. I know that from Dr. Yurt and from Robin and all. We adults who are obsessed with functional medicine or longevity thing, I mean, not many people do much of anything to their kids I see around me.
Right.
I mean, like we take supplements, we don't eat sugar, we are doing, I don't know, ketogenic diet, we exercise. Like we do so many things to make us healthy, not to get old, but not much people do for their kids, at least, majority, let's say. I'm sure there are people who are doing it. And also there's not much knowledge out there for the kids.
Right. So I would say a few things. One is a reminder, and I think that longevity docs forget this because of the kind of questions they ask me, like on the side. We're aiming to be maybe 35 again physically, right? So, I'll get this question about, should I give my kid growth hormone releasing factor? I'm like, no, like we wish we were them, right? So for a lot of things, what we're trying to tackle in longevity medicine is to undo all the stuff we did to mess ourselves up our entire lives. So it's sort of back to good pediatrics, right? Which is that like, it matters what goes in it, I would say parenting an emotional milieu is such a big deal actually in the trajectory of a child. And so it often isn't all the things you would think we have to do for grownups, right? It's like, I'm great at gut health. So when they come out of the mom, we just tune that up, right? Because they come out sterile and the microbiome they get is from their mom. So hopefully she's already been at my clinic and that's already tuned up and the baby comes out great. But if not, I clean that up quickly. But mostly you just let kids unfold the way they do. I mean, don't give them toxic stuff. Don't live in a moldy environment. Don't scream at your kids, all those things. And I think the patients I have will probably not need like as much longevity medicine when they're 50 because we took care of it.
Yeah, but let's talk about normal kids though, not your kids. Not the kids that you're taking care of. Let's address the people that
then they probably need. Yeah.
Let's look to a family that the mother and the father, they're either so tired or so busy that they give the iPad to the child and they allow the kid to eat whatever, like sugar and fried food and all these packaged food and everything, and there's no way that this kid would be healthy in no time.
I think everyone does the best they can in any moment. So you started by saying that family is completely overwhelmed and tired. One of the best things you can do for a kid is have parents who are well, right? That's why we're like a family clinic. So partly that family might need to start with getting themselves well so they can have the energy to do those things. But you're right. I think there's a difference like putting your kid in front of the TV when you shower so that they're like engaged. If they're, I don't know, whatever age for 30 minutes, that's very different than using the iPad as a life tool all the time. And, it's funny, the American Academy of Pediatrics at the beginning of my career was like, no TV or whatever until 5 or 6, I can't remember. And then an hour or 2 hours a day. And they gave up, in the evolution of my career because electronics are now so intimately. So I think one of the biggest problems I see with raising kids is that they don't know how to be bored. This is a huge deal. Like it might not seem like a huge deal, but allowing a child to be bored, is so critically important because that's when imagination happens. That's when growth happens. That's when they learn how to be regulated in themselves and not constantly need dopamine hits. And so for me, one of the biggest problems with like the iPad is these kids have no idea how to be bored, which means they have no idea how to self-regulate, how to, initiate thought. Like all these things unfold, magic unfolds when kids have to create, right? And if we don't allow for the space for that, I think we're going to be in trouble.
Yeah. Besides that, what do you suggest to families not to do to their kids, like food-wise?
Or organic, no question. It's about filling the bucket, right? So do the things you can change. You can't really change whether or not there's glyphosate in your food. You can't really change whether or not you get GMO food. You can try, like, please do try. I like Whole Foods because they've done all the work for you. You can just like go in and everything's non-GMO. But it's ubiquitous now. You can't think that if you spray something here that it doesn't get here over time, right? So there are a lot of things we can't do. or change, but there are a few things we can change, right? So I think water, air, food matters. I think good rest matters a lot, right? I think so about food. I mean, I think, doing the best you can. The mantra I have for feeding with my families is that forever, the parent's job is to provide healthy food choices. The child's job is to learn to eat when they're hungry and stop when they're full. And my job is to make sure they grow well. And then the parent isn't like forcing the kid to eat, and the kid learns to listen to their body. And in that way, we don't have obesity. Like we don't get obesity because these kids have learned how to listen to their body. And the important part there of that equation was that the parents' only job is to provide the healthiest food choices they can. Financially, that's not possible for everyone to give the variety, some potatoes are cheaper than, let's say,
Sure.
organic grapes. So do the best you can, knowing that everything fills the bucket a little bit, and filtered water, filtered air, and the best food you can buy are important.
Try to avoid the packaged food, I guess. You shared something very interesting to me because yesterday I did a podcast with Sabine Hazan, and she's a gastroenterologist, and she has a lab that does stool samples, but like more like a lab, like a research lab, not like a regular consumer. And the day before, I did a podcast with Matt Keberline. And you're the third person today, like back to back, that all three of you, like stool test out there would not show you much of anything.
Right. So I think
accurate information, let's put it this way.
Right. So in short, I don't think it's worth testing something that won't change your outcome or that the answer you don't need. Right. So one is don't even think about doing the stool tests if that's the case. Two is you have to understand what data the test can and cannot give you. So if you think you can test someone's microbiome, let's say, and like once you see what the bugs are, that you can like alter them all, that's not the way it works, right? Everyone's microbiome is different. There are some generalities, like you want less proteobacter, but and also it changes. Like if you change your diet, the microbiome will change in 48 hours. 48 hours. So you see, like the test only tells you what's happening right at that moment. And that's not, for me, that useful. I don't think we're at a place yet where knowing like, what percent of different microbes will tell me how to fix someone. I would say the only time that would be sort of useful is if you got a more comprehensive stool test. If you didn't know what to do, I really like Genova's GIFX. They've been around forever. They have tens of thousands of, I want to say tens of hundreds of thousands, maybe, of samples over I might have gotten that number wrong, but big over the last, they were the first people to be doing sort of all the stuff that I knew about. It used to be called something else back in the early 2000s. They will give you sort of it kind of gives me a sense of like what area, is it mostly pathogens? Is it yeast? Is it inflammation? Is it allergies? Is it lack of enzymes and digestive things? So if you didn't know what to do, and then one of the components is the microbiome. And I think if you just know that you're just trying to get a sense of like the microbiome is great or not, or it's like really off or not, that piece can be useful. But this whole idea that everyone just wants to like map out everyone's microbiome, I actually think is dumb currently and probably not worthwhile. Better to get a doctor who thinks and uses tests only when necessary.
Something now that I remember at the beginning of our talk, you were talking about you were saying to a client of yours that do not worry now, worry when the apocalypse hits. And we forgot about that part. So you meant about COVID over there.
I did.
Okay.
So
tell me what happened with COVID to Lyme.
Yeah. So first I'll say that the statement you're saying is because I have all these kids, right, who have things like chronic Lyme, and we had to sometimes they're out of school. We had to do all these treatments and they feel so horrible and their friends are going on dates and they're, sick, and we get them better, but it sometimes takes a few years, right? And when they're down, I say, I know it's not fair, right, first let's like stomp our feet for a day. But then let's put our big girl pants on and move forward. And I said, and you're like, we've had to tune you all up, right? So don't worry, because someday when the zombie apocalypse hits, you'll be fine. Everyone else will be screwed, right? But I was joking. I mean, the thinking was right, but I didn't actually expect a zombie apocalypse, and COVID is a zombie apocalypse. And so I gave an hour-and-a-half talk even recently on the fact that I actually think that many people with long haulers is actually an unmasking for the first time of chronic tick-borne illness. And the reason why that matters, right, is, for instance, in this lecture I was giving, I've been treating it for 25 years. I'm super good at that. So I could distill ideas that people treating COVID probably weren't thinking of, that, it's just about pulling things out of the bucket so they get back up, right? But long haulers COVID is really exactly the same, right? So it's about living with a chronic trigger, right? And learning how to keep your life well enough that it sits down and shuts up. COVID is a bacteriophage. It is incorporating itself into our microbiome. This is terrifying. Not everyone knows that, but just trust me, it's true. You had Robin Rose on, right? Yes. Did she talk about that?
Yes.
Yeah. So she's right. It's terrifying. I cried for like 3 days when I first realized she was right. This is several years ago when we met, because really my pronouns should be we and us, me and my microbes, right? Like actually, right? And like now humanity is like us and them and COVID. And COVID is a constant trigger. So I think you can very much think about it the same as a chronic tick-borne illness. It's there constantly sort of irritating the immune system. And we see this, right? I bet Robin talked about this. She'll get these super sick people with chronic long haulers, and she'll work so hard to get them better. They're spending thousands of dollars. They're getting tons of IV and stuff, and she gets them well. And then they go back to their old life. They climb Mount Everest or whatever, or maybe not even something that big. And then they're completely bad again. And the people are like, what the heck? I thought you fixed me. So I think that if people, even if they don't believe me, that those are a lot of those people, not all, were living with quiescent Lyme, Babesia, Bartonella, that then was unmasked by the zombie apocalypse. I think it would be easier to treat them if you thought about them the way that those of us who have been treating Lyme for whatever many years. I have so much to say about all this. First is that, COVID actually was maybe great for all of my patients and my field. But okay, well, I have too many fields, but I mean this discussion about tick-borne illness, and actually also about pandas, right? So we started treating.
What did you say, pandas?
Yeah. Oh, yeah.
What's that?
So it's when a kid gets strep, and then rheumatic heart disease we've known about forever, right? So if you get strep, the reason we treat it, actually, it's a self-limited illness, but at about 7 to 10 days, you'll make autoantibodies, and those antibodies can sometimes go crazy, and I'll explain, which is why we treat strep, right? People would get over strep, but we're trying to avoid this because we knew, like even in the 50s, that sometimes those antibodies go rogue and tear apart the heart valves, and that's called rheumatic heart disease, which is lifelong. Sometimes they could go after the kidneys. That's called post-strep glomerulonephritis. And so we knew that all along. And in the late 90s, early 2000s, this smart woman named Dr. Suedo and some other docs, she was at the NIH, started seeing that those antibodies were attacking the brain. And so what you see is this sudden onset, rage, OCD, a whole bunch of stuff. So it looks like bad behavior, but it is neuroinflammation. And as this field was evolving, I had kids with it. And like I said, I'll treat whatever they want. So when the field was evolving, there was maybe like 12 of us in the country who would like talk about patients. I had hundreds of patients who were coming from all over to be treated because most pediatricians don't believe it. I went to my children's hospital where I'm still on staff after all this time. And I talked to the ID docs. I talked to the the rheumatologist. I talked to the general pediatricians. I talked to the neurologist and the psychiatrist, and they all said it doesn't exist. So now you have these kids who everyone says it's bad behavior. The mom has like lost their kid in one day. It is devastating. And so a bunch of us were just trying to figure it out. And so that's anyway what PANDAS is that, for instance, PANDAS, right? So this is evolving late 90s, whatever. And we finally got sort of like real belief behind us in the scientific community. I think it was 2024. It might have been 25. It was just recently, right? But so COVID starts in 2020, and by 2022, we say like there's a thing called long haulers, right? Which is post-infectious, immune dysregulation and neuroinflammation, right? That is PANDAS, right? Post-infectious neuroinflammation and immune dysregulation. It's chronic Lyme, post-infectious or current infectious immune dysregulation and neuroinflammation. And so, PANDAS parents, like on top of all of that, were being like dismissed, and they can't find doctors to help them. And it's really devastating. Finally, COVID, it's here for 2 years. It gets designation in 2022. Then PANDAS gets in 2024 or 25. I might have these two confused. Lyme, it's been over 50 years, right? Wow. Over 50 years. Guess what? In 2024 or 2025, I forget. PANDAS and
because
Lyme.
of COVID, people acknowledge these after effects.
Yes. So what happened is, they've been calling my patients histrionic, crazy, making it up. And suddenly the general population gets COVID, and the medical field's like, like there's this crazy thing that can happen after an infection where people have ongoing symptoms. And we're all like, really? Like, oh, that's a thing?
So tell me, how did COVID affected the kids, or if it did?
Of the people with things like PANDAS, they actually did very well, not just my patients, but the general population. They did surveys. But I would say the pool of children, right? Like in general, how did kids do? Well, it depends. It is devastating what I'm seeing in kids whose microbiome has been set up post-COVID, right? Because there were already like a bunch of hits the moms' microbiomes were taking. Glyphosate, I would say, is one of the biggest. We're now 3 generations in. Each generation is getting sicker. And the babies coming out to moms post-COVID, right? The microbiome they come out sterile. They like suck in the mom's, vaginal flora, and they open mouth kiss each other, whatever, I don't know. Or they breastfeed, and they get populated with what mom has. Well, now mom has COVID. Butyrate and short chain fatty acids, some of the happy bacteria in the gut make products that make our gut healthy, make our brain healthy, modulate sort of, 70% of the immune system is in the gut, right? So now one of the biggest decimations by COVID is that it is like hugely, I want to say like 90% of some of those microbes are down, the good ones, even for a long time after COVID. And that's the microbiome the babies are getting. So those babies are in trouble. Again, like not my babies, because immediately after birth, I give them all the good, I tune up their gut.
Yeah, but tell me, I have to ask you something there, because, how you explained is that the spike protein, if the mother has, passed to the kid.
I was actually talking about not the spike protein, although that can happen too.
Or the bad microbiome, because...
COVID itself. So COVID is a bacteriophage. It is actually, what that means is that it infects bacteria. So just sit with that for a second, right? So normally a virus infects my cell, and then my cell either gets taken over and replicates the virus and then, lets it go, or my immune system fights it and kills it, right? So I can do that. It's very dangerous when a virus can infect a bacteria, because my pronouns are we and us. So now COVID has infected the bacteria in our gut, and it will live there because it's not in my cell, so I'm not fighting it. I already know this is a good guy. Right? So this is a good guy who's now been zombified or whatever, like is a vampire. I don't know. It's living there producing COVID
How
virus.
do we get rid of it, Cynthia? Because,
that's a great question.
Robin did the test to me, and it seems like I have them in my gut. Yes. It seems like she's able to see where it is, The test can say like it's in your lung, it's in your brain, whatever. Mine is in my gut. And how do you even get rid of that?
Well, I would say, first of all, you're talking to the people who are at the very cutting edge of this field, right? So a lot of what I said is not general knowledge. And those of us who are at the cutting edge are trying to figure that out right now. And I would say Robin is doing some really exciting work where some of the researchers that she's worked with, that they are able to get rid of it. However, one of the things that she and and maybe we agree, it's just where like she wants to do that and I don't have the time. My concern is, let's say we eradicate, let's say you do her treatment with V9 and other things. That's a product that she might have talked to you about, which is a bunch of like polyphenols, which is back to just food, right? Food is medicine. So that's why I have naturopaths in my clinic. Like we get it. Although I'm an MD, just wanted to say. So, but let's say you do all that. It takes like, I don't know, 6 months, 3 months for you to eradicate COVID from your gut.
Yeah.
Guess what? Next time you go to Safeway and someone spits on you, so I don't know, then you've got it again. So
So you learn how to live with it?
That for me, because I'm comfortable with learning how to live with something, right? It is exactly
I have to
the same.
say something. Yesterday, Dr. Hazen also approach was great. She says that, it's a matter of creating better bacteria. So like more you populate your gut with good ones, they're going to get rid of the bad ones. So she was like, her approach to this was that. She says like, there's not like specific things. It's like more like the balance. So you focus more to having a good ones. And then the body always gets rid of the bad things if you keep adding the good things in your system.
So two things. One, you're right about the general population of the microbiome, right? So I told you that the good bacteria make something called butyrate, their product, feeds our cells, educates our immune system, keeps them healthy, keeps the environment free of oxygen in our colon, and that beats down the bad guys. So she's absolutely right about that. What's different about COVID, right, is I explained to you, it's living in the healthy microbiome. So that's probably not going to go away on its own ever because we've already become tolerant of that, right? From birth. That guy that he infected, that COVID infected, don't know why I said it was a he. We already said like, oh, this isn't self, but he's our friend. He does all this good stuff, right? So that's a problem.
So it seems like, you need to keep yourself as healthy as possible, not to have a leaky gut, not to have a whatever, so that these things doesn't get and distributed into your system again. I think that's the key.
Yes. And about that, my number one thing that I do for acute COVID, can I say, there's a peptide called lorazepam that just closes the tight junctions, right? And normally you think of that with celiac, right? So in someone with celiac, if they eat gluten, it pops open. But that's not the only thing, right? Bad bacteria, parasites, toxins, and COVID will all pop that open. Now the things in the gut
actually,
are
I'm taking
out.
it now. Dr. Ruth gave it to me, so I'm taking that peptide.
It's because she's so smart.
Yeah, she is.
Yeah.
So let's come back to this early work that you did with autistic kids. One kid at least, the stool transfer, because I'm really, first of all, how do you understand? So when these kids comes to you from birth, most pediatrician, it's like they have a pediatrician when they're born, unless they're transferred from another city or something. How soon you start understanding that there's an anomaly? Do you think that it is a birth defect or happens after autism?
So I would say in general, I should just set the scene for that. Autism isn't one thing, right? So it's very hard. It depends. It's genetic some of the time. In fact, that can be a very useful test because the second they find out it's genetic, the parents will say to me, oh, I realized it isn't anything I did, which is amazing.
Autism can be genetic.
That's right. In some subset. That's why if you make the diagnosis of autism in a child, and there's so much I would say about that, but one of the workups, the general workup as a general pediatrician or the neurodevelopmental docs at Children's, for instance, would test for a few things like, some genetic disorders that could be that. If it's not them, right, then I would say we're back to this, right? So it's a multiple hit theory. That kid came out with some weaknesses of some kind, a bad gut, some genetic things, maybe not that, and some strengths and some weaknesses. And then maybe it was a vaccine. I'm not anti-vaccines. It's always about weighing the pros and cons. In some kids, it does cause autism, that I would say. So they take a hit, right? And then you see autism unmasked. Having said that, I will say that I can tell even by maybe 2 months if I'm worried about a kid, right? You can't really make the diagnosis later because it's really a disorder of interest in communication and actual interaction with people, right? So
around 2 years oldish.
You should do it early. A good pediatrician should do that more like at 15 months to maybe 2. Because one of the leading treatments that works is early intervention, right? And you can cut this part out if you have to, but I can't not say that now, like, everyone is diagnosed with autism. It's become like a flag to wave, for like, I'm neurodivergent or I have ADD. And so like I have autism. That is not what I'm talking about. I'm talking about like autism that drastically alters someone's life and their parents. Really, like, their whole focus becomes about that. That's different than like, the teenager who like is a little anxious in social, situations and gets the diagnosis.
Yeah. Okay, you were saying like I normally feel like when they're around 2 months old that there might be something.
Yeah. I mean, like, I speak kid, right? Like at that age, I have to be like a veterinarian, right? They're nonverbal. So I have to be able to communicate with them, and I need to be able to diagnose things just by, seeing them. And I can tell you a lot of the time at birth, I'll be like, this one is going to take the car when they're 15 before they get their license or insurance, because there's like and then there's some babies who are so zen, right? But the same thing, like a baby who's neuro-irritable, like I'm worried about them. And like I said, that one girl, right? I don't normally send a kid to all the specialists, right? But that kid was neuro-irritable, and I was trying really hard to find it. So I think early on, if they're not okay, I can see it in their eyes. I recently had a kid with a metabolic disorder who was failing to thrive, and she tried to get my attention. She was 4 months old, and I walked in and she was like, and I held her, and then she crumpled, and I was like, what is that? Right. And so then I thought, I wonder if she has muscle weakness. And it was just, she was trying to tell me. She was like, I felt like she looked at me and said, you're the one who can like understand this. So I went out and got glycine and ribose and a few things, and I put it in some breast milk. I gave it to her like in the office real time. And then she like stood and was able to stand. So, a good pediatrician can speak infant,
the baby language.
Yeah.
Can you share the stool transfer that you helped to happen to an autistic kid, and what was the outcome? It's so great.
So first of all, the smartest people I know are often moms of autistic kids, right? Like, like mycelium, how like we figured out in the forest, right? Like all the mycelium are connected. That's how moms of autistic kids are, right? Like, and that's been true forever, right? They're like an underground, they know things before. If you want to learn stuff about medicine, you should talk to moms of autistic kids. So I, this was early on in my career. It was maybe 18 years ago. I had one of the kids I had with autism, we were talking about the gut in that kid maybe being one of the primary issues. And back then, my bag of tricks was not as big, right? And there's some really big thinkers in the field around here, like in chronic Lyme and things. But again, like the idea is the same, right?
Sure.
Who had a protocol for doing fecal transplants in people and, like how to strain it and what to do with it and how to implant it. And so this one family decided that they wanted to do that. So we came up with a protocol, we tweaked it a little bit, but then the hard thing was to find a donor, right? Like who's the healthy one anymore? Doesn't know, but there was a family that lived on a farm in California that had only ever had good stuff, And so the family actually flew to California, got the fecal material from this family, and then strained it and everything and put it in rectally for the kid. And we saw it wasn't everything, but we saw changes in interaction, changes in speech, changes in irritability. And that would make sense, right? Because again, like the gut and the brain are really, really connected.
So basically, we can say that one of the very major treatment of an autistic kid, it doesn't need to be a stool transfer, but a very, very healthy gut. So if you work
Absolutely.
on the gut, that will really help a lot. Maybe not change 100%, but
right.
It will make a huge difference, it seems like.
Absolutely. Absolutely. A hard stop. And the earlier you do it, the better, because there are some developmental phases in pediatrics that once you get past, it's harder to go back.
Like what? What age?
Well, I mean, like, if you walk before you crawl, right, the brain doesn't set up right. We're supposed to do this thing. That's like one example. There's, we learn who we are in the world in relation to other people. If you don't have relation to other people until you're 10, you have developed differently, right? We're supposed to figure out how to sort of become our own person and separate from our parents a little bit at age 7, and then we're supposed to look to our peers at 13, stuff like that.
Yeah, 7, 13, I see all these stuff. So, these days we also hear a lot of kids with ADD, ADHD. I'm sure you're having a ton of them.
We'll always have that. I would say that's not, maybe it is more now because kids aren't as healthy and COVID and stuff. But go ahead, sorry.
Yeah, that's okay. Because you say that you have lots of tricks in your bags to help these kids without medications. First, I don't think that the first thing that you reach out is a medication, is it?
No. So again, it's about weighing the pros and cons. And really, truly, I wish I could talk about this for an hour, but I think ADHD is actually a superpower. I think that, if I say to these kids, boring people go 55 miles per hour and they have good brakes and steering, someone with ADHD goes 200 miles per hour and is like this. But what that means is they can get to all these different places and they can make these connections. They're brilliant. The problem is they can't steer and they don't have brakes. So if you want them to sit down and be quiet when you're boring, like in class, that's hard. Right. So for these kids, it's about learning to be you in the world. It's not like really a diagnosis in the way, like it's not a cancer or something like that. It's really what you're seeing. But so I explain to them it's their superpower. And if they've got the skills to be them in the world in their job, which is this case school, then great. So it's about, learning tricks as a family, like I have a horrible ADD, clearly, right? So, so if I have to sit in lecture, then I take a pill. If I'm in clinic, I go into one room, that patient is so engaging to me and I'm putting together all these things. And then before I get bored, the nurse brings me to the next room, right? So that's me learning, and I make lists. And so that's me learning to be me. So the family helps the kid figure out how to be them in the world. But what happens is I mentioned that during that time, they're learning who they are in relation to others. So if what they're hearing from the parents or the school or their scores at school is that you're irritating, you're trouble, you're not smart, they often are smart, but they can't pay attention, like way less than I hate medicine, or I don't hate medicine, dislike medicine or that kind of thing. I really dislike how it will affect the way that child feels about themselves over time, right? And so for those kids, we give them medicine, but their age is usually enough that we have this discussion, right? And they can take these meds every third Tuesday if that was the day they had class, right? Or like I do just at conference. So, but these kids suddenly, they can be still and calm in class. And, because the other thing is they interrupt, right? It's like I get excited and have to say things, right? So that can be very irritating. And the parents will be, I remember my mom said to me when I was like 13, like Cindy, sometimes you're just so hard to be around. And I remember thinking, like, just my essence, like, really? And so for these kids, luckily I was like, fine, whatever. I turned out fine, but for these kids, if that's what they see in their mom's eyes and that's what they see in the teacher's eyes, that's devastating. And they're learning who they are in that way. And so medication is super helpful in those situations.
What's your suggestion, or what do you think that, how long mothers needs to breastfeed their kids? Is
Yeah.
there like a magical number?
I think there is. So,
Okay.
first of all, I'll say no judgment. Like, I got to just set the field. Every parent does the best they can and they make the decision that's right for them. So any mom who chooses not to breastfeed, I do not want them to listen to me right now and think that they should judge themselves. Do the best you can. But in a perfect world, even C. Edward Koop from the 80s, he was our Surgeon General here, said moms should breastfeed until 2. Remember, that wasn't popular then, of course. But if you look at their brain development, right? Remember, I talked about our growth grids, right? Is that, let's say I want to do it the right way. The head, the circumference, grows like this until about 18 months, and then it settles off. Well, that is also when our sutures all close. And what drives the brain size or the head size is the brain growth. And what drives that is really important fats that myelinate our neurons, right? What is that made out of? You said day and good now, plasmalogens, right? What do a mom who has plasmalogens gives it via the breast milk to the baby, the precursors. So if you don't have those good fats, you can't make your brain. And there's a critical time that ends around 18 to 24 months. So in a perfect world, that would be as long as you breastfeed. But I would say in some places that's not socially acceptable. And, some babies will like wean themselves at 9 months. Those are the kids who are going to be like waving behind your back, like walking off like this to kindergarten. You know what I mean? Like they're like, fine, whatever.
Is there a good thing that if they continue breastfeeding them? I spoke with someone the other day. I did an interview, and she said that, because she had a C-section, she wanted the kid to have a healthy immune system, so they should try to breastfeed them until 4. One until 3, the other one until 4 years old.
So I would actually say, so myself, I breastfed 1 to a year and a half, 1 to 2, and 1 to 2.5. Like, it's not all the time. They're not hanging off the breast, right? So it's like, before bed or something. So I would say first to that mom, she should do whatever's right for her. So that's great. And she's right also because what is great about breast milk when it comes to the immunity, right, is that when they were inside of you or the mom, they were given all the antibodies the mom currently had. When the baby comes out, their immune system isn't that savvy. And so if the mom like kisses the dad and the dad has flu, the mom makes antibodies to flu and gives those through the breast milk. And so then they get into the flora of the mouth and the baby's like ready to not even catch it. So she's right about that. But I would also say that in my autistic kids, for instance, I would often have moms continue to pump and give it via cup after, the age 2, even until they were like 6 sometimes, because I didn't have another way to give plasmalogens, right? So I was trying to get the essential fatty acids into their brain. I knew they needed it, and I didn't have a way. And then I met Dayan, March of 2021, and I cried because he created that. So I actually gift plasmalogens to all my pregnant women because I don't want to take care of babies without good brains. And I have every mom start Glia if they can financially.
Before we close, I want to add this. I've been reached by a family a few weeks ago, and it seems like they watched the program of me with Dr. Goodenow, and they were trying to reach out to the clinic for their autistic kids. And they asked help from me. By the time I get back to them, actually, they hear back from the clinic. So it warms my heart that I'm able to help people, at least people who can reach, afford, travel, because it's not that easy from all the way from here to Los Angeles or Canada. But I'm sure that our podcast here is going to be a light to so many people whose struggling with Lyme or have kids that they don't know what to do with them. Your guidance about how to deal with an ADD kid was actually very, very beautiful. I think that's a
Thanks.
great, it was really great. I think because you suffered with it. That's why it seems like,
Yeah.
you're hearing from your mom. But, I would like to also add that the other day I had a patient coming to me, and actually he described his childhood like that he
Yeah.
felt like he was a disturbance to everyone. And even his
Yeah.
friends, when, he was going by them, that they were like, oh, he's coming again. So,
See?
yeah. And he's 44 and he still carries
Yeah.
that.
Right. It like during our formative years, we determine who we are in the world. I mean, it's amazing. And I also have to say that there's a lot of data to show it takes one non-parental adult to change the life of a child. And that means that, like, to all the people watching, like, if for you, right, it's not your kid, but you see a kid who's, struggling or something, like being present, showing up, seeing that kid and being a resource for them absolutely change the outcome of their life. So if they are one of those kids who has a mom goes, and all the teachers go, you know,
Just give them a hug.
yes. And be present for them. And, yeah.
Cynthia, thank you so much for your time. It was great. Finally, we were able to make it.
Yes.
And I'll see you soon, I hope, in
Yes.
America.
I think so too. And thank you for today. This is actually my first podcast. I've been
You were
asked for
great.
years, and I picked you. Yeah.
Thank you.
Yeah. Thanks so much.